Hi everyone, Dr. Jeff back with this week. We're here with co-op student Magdalene. She's our new student. Kelly's gone back to school and Magdalene's kind of joined us for the term. So she's got some pretty exciting ideas for our videos for this term. And tonight's one of them. What are we talking about tonight?
We're going to talk about FOOSH injuries, and that is F-O-O-S-H.
What is that?
It stands for a fall on an outstretched hand. This can happen during instability or high impact, where you brace the fall with an outstretched arm. And so this can happen in both young and old. During high impact sports, this can happen. Most cases that's when it's happening in younger groups. Sports such as snowboarding or football, high contact sport.
Yeah, so I know in our office here, for the younger people, rugby, snowboarding, skiing, football, any of these high contact sports, even in things like judo and karate and things, we can see that. The older people, it's more going to be up in here. The older people generally are a little more osteoporotic. We get worried about them. And when they fall, sometimes they fall in outstretched hand, but sometimes they roll more. And they're going to be breaking the humerus or breaking their shoulder blade. Those are more the common types of injuries when you're falling with an outstretched hand if you're older.
Mm-hmm. And so in older populations, this can happen due to instability, vertigo, or like a tripping hazard.
Mm-hmm.
Mm-hmm. So what happens in most cases is that you feel immediately that something's wrong with your arm. There could be a fracture or a sprain or strain with the muscle. And you'll go in and seek help immediately and go to the emergency room. In other cases, you can't tell that it's broken immediately, and the next couple of days it gets worse. And so what do you do in that case?
Well, yeah, like a lot of people know immediately that something's wrong because their wrist doesn't bend or whatever. They know immediately to go to the hospital or see the family doctor to get imaging done, to get an x-ray done to see if something's broken. Because the big thing we want to see here is we want to know if it's broken or we want if it's just a sprain and strain. Because if it's broken, we really want to make sure we're getting it casted and set properly. Because the sprain and strain is going to affect us when we're trying to treat you. Other people, we've had people come in and they go, oh well, I fell and everything's okay, and here we'll do something called a tuning fork test, so a tuning fork or ultrasound. So instead of an x-ray, we'll actually put a tuning fork on it. What we find with a tuning fork, you put it on and the bones will vibrate, and that causes sharp pain. Or the same thing in ultrasound, put ultrasound over the area, and that causes the bones to vibrate, and we'll know right away with that if it's fractured or not, and we can send you out for an x-ray then to confirm our diagnosis, whether it's fractured or not. But again, it's very important that we know what's wrong. And if you have a fracture, and one of the biggest ones is a scaphoid. It's a bone that's just in here, kind of in your thumb. When you break that, it has very poor blood supply. And a lot of people, if we don't get that casted or set properly, that bone can actually die. And then they have to actually put an imitation bone in there for your wrist. Hook of hamate, another one. A Coley's fracture is another fracture up in here. These are all ones that it's really important that we know if it's broken and get it set properly.
Absolutely.
Yeah.
So what are some things we can do to prevent these injuries from happening?
Well, one of the big things, I remember when I was younger and snowboarding was just coming on, and all my buddies were saying, oh, come on, you got to learn how to snowboard. I go, man, I said, I'll tell you what, I said, I'll just stay here and fix you. Because they're coming in and they're falling with their arm, they're falling on their butt, hurting their back. One of the biggest things that come out were wrist braces or wrist protectors for snowboarders. So when they're falling, their wrist can't bend too far. Kind of protects their wrist and keeps things from breaking. You can't really do that in football, but in football, a lot of times they'll be taping your wrists up to make sure that, again, there's some stability there for you. If you're an older person, the biggest thing, again, we talked about is falls and trips and stuff. So one thing is making sure that if you're getting up at night, to turn your light on if you're going to the bathroom, make sure you're getting up. Wash your rugs, wash your cords at home, make sure you're not tripping over it. If you are a little bit unsteady in the gait, make sure you use your walker, make sure you use your cane. These all prevent you from falling, because the worst thing you want to have happen to you is that you fall and especially whenever you fall, people are going to put their arm out and you end up breaking something. So it's a lot better to actually protect yourself beforehand than to wait for something bad to happen.
Absolutely. Things like proper footwear, and if you're carrying a big object, like making sure you're extra careful if you can't see in front of you, and just taking your time to make sure you don't fall.
Yep, and I'm bad for that because I want to make sure I get things done in a hurry, and that can lead to complications.
That's right. Okay.
So if you like the video we did tonight, give us a thumbs up, share with your friends. And if you have any topics you'd like us to discuss, you can always send them in to us. Magdalene will research it for you, and we'll go online with you. And here goes to wellness.
We got your back.